Hello and welcome to ICMDA webinars. I'm Dr. Peter Saunders, the Chief Executive of the International Christian Medical and Dental Association. ICMDA brings together over 100 affiliated national associations of Christian doctors and dentists around the world, representing about 60,000 practitioners altogether. So it's a great pleasure to introduce Echo VanderWal, our speaker today. And in Eswatini, which is one of the countries most affected by HIV, the Luke Commission has developed a community-based model that integrates HIV services within comprehensive primary care. Rooted in Christian mission and local leadership, this approach combines mobile outreach, patient-centered care, resilient supply chains, and digitally enabled systems such as Luvelo to deliver consistent, high-quality care to underserved communities. Rather than vertical programming, the model strengthens the entire health system while ensuring that people living with HIV receive lifelong support. This presentation is going to explore how faith-driven innovation can advance efficiency, accountability, and sustainability while ensuring that the most vulnerable are not left behind. Echo VanderWal is Executive Director and co-founder of the Luke Commission. Hi, Echo, a faith-based non-profit advancing equitable healthcare in Eswatini, which is, if you don't know, a very small country in southern Africa, surrounded by South Africa, and also in other resource-limited settings. She's a visionary global health leader. She helped pioneer the Luke Commission's holistic care model in response to the country's high HIV prevalence. And under her leadership, TLC, the Luke Commission, has grown into a major healthcare system serving hundreds of thousands of people annually. Echo graduated with highest honors from Cedarville University, and she lives in Eswatini with her husband, Harry, and their 7 children. Echo, such a pleasure to have you here today, and we really look forward to hearing what you have to say and engaging with you in the Q&A later. Over to you, sister. Thank you.
Oh, thank you very much, Peter. It's great to be with you, and I look forward to the discussion today. Thanks a lot for having us. But it's such a blessing to share about the 20-year journey that we've had in Eswatini, a nation of 1.3 million people with the highest HIV prevalence rate in the world. And we have seen God move in mighty ways in very difficult circumstances. I was called to serve overseas at the age of 8, and my husband, Harry, when he was 17. We met when we were 19, and I think we fell in love first with serving God together in Africa because we had both been called at separate times, and then with each other, and we married at 21. Harry trained as an internal medicine pediatrics doctor, and I trained as a PA or a mid-level practitioner in surgery and pediatrics. After Harry finished medical school, we were blessed with triplet boys. And at our first ultrasound, Harry said, "We can either enjoy this or complain about it. Either way, it's the same amount of work. It's all about our attitude." And that mindset really helped to prepare us when God dropped us into the epicenter of the HIV pandemic in Eswatini, formerly Swaziland, in 2004. That was when we went on our first visit to Eswatini, and they took us immediately to rural areas, and we saw young people dying in every home that we went to. Families were being torn apart, leaving scores of orphans behind. In fact, during this period, 20% of our nation became orphaned. It was a devastating situation. International agencies were warning that if drastic action did not happen in Eswatini, by the year 2050, Eswatini would be considered statistically extinct. When we went to Eswatini, we didn't find people working with comprehensive healthcare in rural areas. In particular, people were saying that they didn't have money for transport, as we hear in so many other contexts like Eswatini. And so there was a separation between care and the need. And so we felt that God was calling us to found the Luke Commission. We used funds initially from a real estate development company that I started when our triplets were born, when Harry was in medical school. In 2006, Harry took his boards, and a month later, we moved to Eswatini with our 4 young sons that you see here, who are the triplets turned 25 in June, so it's a bit of time has passed since then. When we went to Eswatini, there were no testing kits. In fact, for the first several years that we were there, really, you could see what HIV was affecting people, but there wasn't a way to diagnose them. When the testing kits finally arrived in one community, every day we were testing about 250 people positive. And at the time, there were severe limitations on the number of antiretrovirals we had. And so, of those 250, we would have to choose about 5 that we would start on antiretrovirals. As I mentioned, for many, healthcare was out of reach. Most of the limitations around transport, and even when they went to the facilities, not finding the medication or the service they needed, and of course, stigma was very high. So we went and built relationships in rural communities. We started with a team of about 10 and were the only healthcare providers for the first 8 years. Fast forward 20 years, the team has grown to 500, 97% are local staff with 45 divisions, and we scaled to serve about 300,000 outpatients annually and admit a very high percentage of the ICU cases for our country. We've found combining compassion, innovation, resilience, a diverse solutions toolkit, and international standards allow patients to receive high-quality integrated care at the lowest possible cost. We believe that every patient that God allows us to see is a VIP, a very important patient. God had been preparing our hearts for some time.
I was raised in Florida originally, born in Florida, and then my parents moved to North Carolina when I was about 6.
We did grow up poor, but not poor in spirit. My parents, they always told us that the sky's the limit, that we need to do anything that God tells us to do, and that has really been a guiding light for my life.
My dad is a Dutch guy, so a little bit frugal. But we actually built the house as we lived inside of it, and we had tarps over the roof while we were living in it. We had pit latrines. We washed in the creek and then in the sink that was there. We really lived very low key.
We didn't have health care insurance when I grew up. Or when my sister was 15, she was very sick, and my father tried many times to get her admitted at the hospital, and they refused. And I was 17 at the time. I knew very well they were refusing us because we didn't have health care insurance. I feel brokenhearted for people who don't know what love feels like and don't have access to health care.
Definitely, God used those growing up years for us to understand what poverty looks like and to be able to relate in the place where God called us. We always took our 4 boys with us. Every time we went to outreaches, they would do video school on the bus, and when they were finished, they would get off and they would start working with us. This is our 5th child. We had a girl after working in Eswatini for 8 years, and this is her in the field with us about 2 weeks after a cesarean section. The children built bridges and relationships that we could have never built alone. It was just such a joy working with them as young children in rural areas. Oftentimes, it was difficult reaching the sites that we went to, but we never missed a site in all of these years, and we're so grateful to God for his provision during all of this work out in the rural areas. To preserve trust, we worked late into the night to care for everyone who was waiting. Our boys would just fall asleep on anything, anywhere. And when we were done, we'd pick them up and put them on the bus and take them home. This was our home for the first 8 years. These were the containers that were our warehouses. In the bedrooms, we stored commodities. Harry and I shared one room with our 4 boys, not because we had to, but we say we were living the dream. We were doing exactly what God called us to. All of us with the staff ate in the small kitchen. And then in 2013, in just 17 days, there was a miracle. God opened the door for us to purchase 200 acres, or about 80 hectares, of farmland in the center of Eswatini, and this became our new home. It was amazing to see the way that God raised the funding for this land in just 17 days. We're very grateful. We moved those containers down and we started building, which was just farmland at the time. Since 2013, our local team has built 25 buildings on the Miracle Campus, which has become a beacon of hope and healing for our nation. Fast forward to today, our triplets have graduated from university with degrees in international business, cybersecurity, and business management. The last one is now in medical school, the one that graduated with a business management degree. He's just finishing his first year of medical school in Virginia. The 4th one is in his final year of business finance. And we never expected this, but God led all the boys, who are now men, to stay and work with us in Eswatini. It's been such a wonderful blessing and not something that we ever expected. Since arriving in Eswatini, we've welcomed 2 more children, a daughter and a son, 13 and 11, and we're so grateful to now have our daughter in love, Nami, who's joined our family, and she was orphaned during the HIV crisis and grew up in a children's home. She calls us mom and dad, and we feel so grateful to have her in our family. Since then, Luke and Nami have had a son and a daughter, and we're very grateful for everything that they do in their service in Eswatini as well. I'm just going to show a video now of what things are like now at the Miracle Campus. It'll give you a bit of an understanding of just where God has taken things from and to.
Sanibonani, warm greetings from the Local Mission Miracle Campus here in the heart of Eswatini. Every day, our team delivers high-quality, compassionate, comprehensive healthcare grounded in compassion, strengthened by accountability, and driven by innovation. A year. For nearly 2 decades, our mission has been simple: to care for every person with the same compassion and dignity we would want for our own father, mother, brother, sister, or child. The Miracle Campus is a strategic continental hub for clinical excellence, digital innovation, supply chain coordination, and competency-based training. As Eswatini's central referral facility, the campus houses comprehensive outpatient and inpatient departments, advanced surgical theaters, emergency care, specialty clinics, and TLC's national supply chain hub. From primary care and community outreach to advanced tertiary care, including joint replacements and cornea transplants, in partnership with traditional and hospital community leaders, TLC brings hospital-level care directly to the people, reaching families in every chiefdom in Eswatini. During the COVID-19 pandemic, TLC built and operationalized Eswatini's first oxygen plant, now the largest PSA production facility in Africa. The plant has produced more than 500 million liters of medical oxygen and saving countless lives. Eswatini has 8 species of venomous snakes, including the feared black mamba. But today, what was once believed to be a death sentence has been transformed by clinical excellence and rapid coordinated care. In 2024, TLC treated 420 snakebite victims. There were 0 deaths. Luvelo is TLC's mobile-first AI, the realities of emerging markets. It has already enabled more than 8 million medical services and is used by national railways, government systems, and large service delivery organizations across Africa. Luvelo streamlines workflows, strengthens accountability, and provides real-time supply chain visibility from procurement to patient delivery. Recognized by the Africa Supply Chain Excellence Awards and the Financial Times World Bank Africa Sustainable Fisheries Awards, Luvelo is a key pillar for TLC's global impact model. Luvelo is now empowering partners across Africa to strengthen governance, reduce leakages, and modernize service delivery. Behind every system is a person. Heartware is TLC's people transforming engine, shaping character, unity, and excellence. Through structured formation pathways, mentorship, conflict care, team support services, and the Basecamp onboarding program, Heartware builds the trust, cultural alignment, and purpose-driven leadership needed to deliver world-class care. TLC's integrated telehealth solutions bring care even closer to the home. Consultations through CareChat to containerized telehealth hubs with smart vitals capture, automated e-dispensaries, and video consultations. TLC operates the world's first truly nationwide medical drone delivery network. Battery-powered, solar recharged drones deliver samples, medications, and critical supplies between the Miracle Campus and health facilities anywhere in Eswatini, often in under 45 minutes. All drones logistics are fully coordinated and tracked through Luvelo, ensuring end-to-end accountability. Through TLC, Luvelo, Heartware, and the Miracle Campus model, we are building scalable solutions that enhance patient care regionally and equip partners globally. Siyabonga kakhulu. Thank you for believing in the power of compassionate, accountable care. The future of African healthcare is bright, and together we are building it.
We're so grateful for this infrastructure and land and buildings that God has given us over the last several years, which is serving as a supply chain hub and referral hospital for the region, providing primary care in our rural communities to tertiary services, including critical and specialized surgical care. Three pillars have guided our What would I do if this were my family member? And then another miracle. In 2020, Eswatini became the first African country to reach 95, achieving HIV epidemic control. And then the next tsunami. As I mentioned, at the height of the HIV pandemic, 20% of our nation was orphaned. As TLC grew, we knew and realized that many staff were orphaned, carrying deep trauma and unprocessed grief. God told us to create a place where people belong, a safe place for inner healing, guiding staff from surviving to thriving. He told us that even those of us with parents have an orphan spirit, and this spirit needs healing in all of us. Just 10 years ago, God challenged us. What are you doing to heal the hearts of the adult orphans working for you? He pressed further. You expect healing. You expect compassion. You expect love. But how can you give love when you're wounded? We started a 6-week intentional onboarding process to grow compassionate leaders in personal growth, leadership development, Christian faith, service learning, and on-the-job training, all with a strong emphasis in team unity. New staff have time to absorb TLC core values, teachable spirit, looks for solutions, committed to every last one, not about me servanthood, and an attitude of gratefulness. To understand the order of our core values, calling is first. It's the anchor, it's the hook, it's the why we do everything we do, it's the reason we don't quit. And competence, while it's so important in medical work, it mustn't be the first submission. It mustn't be what we focus on, but it must be in submission to the first four: calling, character, culture, and chemistry. God blessed us with a training and leadership center of excellence, built by about 50 churches. It is a place where our souls rest and restore, with an auditorium large enough for the whole staff. At TLC, onboarding isn't just joining an organization. It's joining a mission, a movement, and a calling. You're not just an employee. You are family, and you belong. You are part of a team that is transforming lives, starting with your own. Recently, Base Camp 57 graduated. Now we have had over 1,500 graduates. By far, it has been the most transformative thing that Harry and I have ever experienced in our 2 decades in Eswatini. Every morning, our team gathers for prayer, scripture, and recites our mission, vision, core values, core qualities, and creed. Ending with, we seek to preserve life, provide relief to the suffering, and share the hope of redemption and restoration today and every day as representatives of Jesus Christ. With unified alignment, the team deploys to assignments across the country. This inner healing process has just been so transformational in the work that we've been able to do, and most importantly, developing the resilience that has been so necessary. This resilience came just in time. During COVID, most facilities in our country closed or stopped accepting patients due to lack of oxygen and other challenges. This was our ICU during the 3rd wave of COVID. We supported our government in 3 key ways. ICU cases. We built the oxygen plant that they referenced on the video, and we developed a digital system for the National COVID-19 Vaccination Program, which was actually recognized by WHO as having a 100% utilization rate because of the end-to-end supply chain accountability. But our biggest challenge during COVID was in the 2nd wave. We were completely dependent on South Africa for oxygen, and we were only receiving about half of what we needed. This is just 1 day's worth of empty cylinders waiting to go back to South Africa to be filled. Like in wartime, we sent an SOS out to senior leaders, asking for their best of the best. This is an IT manager who managed regulators the whole of the second wave. Our software engineers used Pluvelo and the real-time data to determine the size of the plant. We installed the reticulation system, while our construction team built the plant. These are pictures of them building the plant, and they built the plant shell in just 52 days. And then on the 9th of June, 2021, for the first time in our nation's history, we opened and started producing oxygen in Eswatini. This oxygen changed everything. This is pictures during the ambulances arriving with rapid-fire succession from across the country. Our spiritual care team embedded full-time with the medical staff, ensuring staff and VIPs were always supported. Many ambulances were carrying 2 or 3 critical patients at once, and we used this tent to triage patients during that time. This is just that time lapse. This is where patients would be triaged, and inside was the large ICU. In this picture, there's 48 people on ventilators. The digital system mitigated unnecessary loss of life, and our team never quit. And we witnessed another miracle. During the second wave, Eswatini had one of the highest case fatality rates in the world at 4.4%. By wave 3, with enough oxygen, ventilators, and a team willing to do the hard work, it dropped to 2%. At the same time, the number of patients coming for care skyrocketed to nearly 300,000 outpatients a year. Compassionate resilience also closed critical gaps in specialty care in our region. Using the digital system, we connected with specialists all over the world. Over the past 10 years, having operated on over 5,000 patients in the last in our surgical eye program, and the team has done so well with a complication rate demonstrates how the digital system tracks time and motion to ensure every second counts. These are pictures of the patients coming from the operating room and then waiting for their patches to be removed. Over the past 3 years, we've trained a team of local orthopedic surgeons to perform joint replacements. This is a picture of in October of last year of several people getting hip replacements. This is a program that's been supported by faculty surgeons from the United States.
Hi, my name's Greg Stocks. I'm an orthopedic surgeon in Houston, Texas, specializing in hip and knee replacement surgery. It's been such a privilege to come back to Miracle Campus for the Luke Commission this year. This is a very special place. What's special about it is how everyone here authentically leads with compassionate care. I have not been to a place where the patients are all called VIPs, very important patients, and they are all VIPs. And the authenticity that I hear in the voice of every person who interacts with a patient referring to the patients as VIPs is incredible.
Over the past several years, people have come from every continent to visit the Miracle Campus, most of the time drawn by the oxygen plant, the digital system, the telehealth hub, or the drones. But when they leave, they realize it's the people who make the real difference. Johnson & Johnson, I've never seen anything like this. You are doing should be done elsewhere in Africa. Our former Prime Minister, if government had even 50% of the real-time data TLC has, we would have a thriving economy. World Bank Country Director, this is a quintessence of excellence, innovation, and impact in health services. How can we scale this in the kingdom and beyond? and a senior political advisor who worked heavily with the Rwandan's president during the economic recovery from the genocide. TLC's commitment to and systems for organizational excellence will save more lives than TLC's work in healthcare. And in 2022, he said the digital system you have built can change the GDP of nations. And that helped us, that really made us do a full stop and recognize that possibly some of the tools that have been developed just to solve our pain points could be adapted and used around the continent to change the GDP of nations, which we all know will affect the most vulnerable. This is a picture of our King Mswati III when we had the honor of showcasing the telehealth hub in 2024 at the Eswatini International Trade Fair. This video shows the high demand amidst a very difficult situation in Eswatini, as we also have understood in the countries that we work in. We've been crippled by severe drug shortages for many years, and over the past 5 years, we've been advocating at the highest levels for national and continental healthcare reform. What we knew, this video that I showed you was just on the 20th of January, 2025, right before the USAID cuts. And then, as we all know, something happened in January of 2025, and we have felt in the past year that this may be the unexpected missional revolution. Our 15-year relationship with USAID ended in just one moment in January of 20. About 1,000 patients a day, as you saw in that video, to around 100 patients a day. And for the first time in our history, we had to install gates for security at the hospital campus because the pressure on the system was very intense. Reimbursement systems stopped, which meant salaries for staff were delayed for months. And I was so touched because the team continued to work, even at one period when we were not able to pay salaries for 3 months. During this time, we believe God is doing something deeper and something big is emerging. We know God has solutions to the problems that we're all trying to solve. What might the future of this unexpected missional revolution look like? Framework to us for sustainability in July of last year. We felt that the global health sector was very unbalanced and we were all relying on that. But what if there was a more balanced approach through public sector, faith sector, global health sector, and private sector or social enterprise, which we feel should be the foundation moving forward? Global aid had become dominant, and when that pillar shifted, the healthcare system in many of our countries became unstable, as you can see in this description here and also in the video that I showed you a few minutes ago. So we had been wanting for several years to pivot, especially after COVID, when we had so much intense pressure on our institution. And this change or unexpected change allowed us to launch something we call the EquiCare Partner Network, allowing us to bring together other business entities that support and subsidize the work that TLC does in the hospital context or the community health context. It represents a new approach, building social enterprise engines that can sustainably support hospital care in fragile contexts. We've also been able to go around the continent to look at other hospitals and where Luvelo, which has become our digital backbone for coordinated health systems, could be applied to help leadership, implementers, and of course impact the people that God has called us all to serve. I will just show you a short video from that award ceremony in South Africa, the supply chain award ceremony, and how critical we feel that supply chain excellence is in the next season of global health.
It's hard to talk about this particular award without being really emotional. You've seen the team here from Swaziland. I think it was certainly a unanimous award from the judges. And if you talk to Mike and to Martin, 30 years of judging, the best entry they have ever seen. I mean, it's very unusual, but they scored an average of about 94% on their scoring. I've never seen anything like it at all. So for the special award, top award of the evening, can I ask the whole team from the Luke Commission for their entry livello to please come up?
Some of this recognition that we never expected has opened doors for us to be able to go around the continent and do scoping exercises at other facilities. These are timesheets and medical records that, of course, moving into the next season, need to become more efficient and more digitized and more streamlined. God also opened the door for us to go to Korea in October. There, God did an amazing work in bringing together faith leaders through the words of Rick Warren there, saying that a third of Jesus' work on this earth was healthcare. If that's true, what does the next season of healthcare look like for all of us who are trying to navigate this new missional revolution? We were able to meet with continental leaders, and God did an amazing work there in Korea, where they decided, after a private session with Rick Warren, to form a health commission for AEA and WEA, the evangelical associations in Africa, as well as at the global level. We also went to a missions conference in Louisville, and we're so glad to see Peter there, who did such a great job of connecting the dots. You can see him there and opening up our eyes as what can we do that is more collaborative in the next season than what we did in the past season. And we're very excited about seeing what God is doing to bring collaboration together in a new and different way, maybe, than we've seen in the past. We've seen him breaking down silos. We're very grateful that in February, faith leaders that were in Korea were able to come to Eswatini for a roundtable from Kenya, from Zambia, and from Zimbabwe. We were so privileged and honored to host the church health associations from all of those countries, as well as the church leaders. We had an amazing time together reflecting on the past and then asking a question: what does God want for us for the future? It was a powerful moment of unity and shared purpose. And I'm looking forward, Peter, just to talking to you now about your thoughts about the next season and what it looks like. It's been such a faith journey for all of these 2 decades, but definitely the last year, more of a year of reflection. God, we see what you've done in the past, but what do you want for the future? And what does that mean for all of us as people who have been transformed by faith, and how do we continue to walk out that faith into the new season? Thank you very much for having me. Appreciate it so much.
Thank you so much, Echo. Wow, amazing. And brilliant presentation, but covering just an extraordinary journey of faith in action where God led you from very, very small beginnings to something really quite incredible, and now looking forward to the future. So we've got a time of Q&A now. I just wanted to start, Echo, with your testimony, really asking you, and you've touched a bit on this, but just what were the kind of critical experiences in your journey together that God used to prepare you for what was coming? Because I don't think you would have had any inkling or imagination of what might transpire in 20 years when you first went out to Eswatini. But what were some of the key moments for you as a couple and as a family and as a faith community?
Thank you, Peter. I think maybe I could just start with my parents. Even though I grew up in a home that most people would call impoverished, my parents never let poverty define us. They always said the sky is the limit. Do whatever God calls you to. So when God called us as kids, they nurtured that calling, and I think that was very pivotal for us. And when Harry and I had the opportunity to visit Eswatini in 2004, of course, there was a lot of things that were not defined, and we really felt like God wanted us to take a blind step of faith. I would say that those blind step of faith, when we didn't really know what he was doing, but he said, take a step, and you would say, but what's going to happen? Or what's the next step? And he said, I'm not telling you the next step until you take this one. And I think just getting into an understanding that if we can take those blind steps of faith, it leads us to his next supernatural miracle, which we could have never anticipated or never really even never strategized. Even if we were writing the best strategy with the biggest budget in the world, we can't strategize what he has in his heart for us. And so that I would say those have been the defining moments for us. Are we going to take the blind step of faith, or are we going to live with a spirit of fear, or trepidation? And I also was so grateful in those early years, which I would say in the early years was very much in a wilderness with God. It was not, didn't feel like a wilderness, but it was a bit isolating. And during those seasons, we really felt that God was saying to us that, you know what, even if you take this blind step of faith and you figure out that it's a mistake, I love you enough and my grace is enough that you can get up and you can brush yourself off and go on. And I think just having that understanding of what his love is for us, it's it's a love that maybe sometimes we can't even comprehend, or most of the times we can't even comprehend. But he's okay if we make a mistake and we get up and we brush off and we move on. And I think those are the things that were very that were guiding lights for us in the early days.
Now, it was a long time before you really started to see the incredible results that you've seen now right across the board. And as you said, there were times of isolation and loneliness and doubt, I'm sure, as well. What was it that really kept you going through those early years?
It's the calling. It's the calling. And I can tell you that in 2013, one of my advisors told me that you can't scale compassion. And I almost believed her because
Yeah,
com calling is so critical to the question that you've just asked. And
yeah,
I'll just talk about that for a second, then I'll talk about how I saw God scale compassion. Again, one of those supernatural things that he did through the team. But in those early days, I say this, the only reason I haven't packed my bags a million times and left is because God called me and he never released me from that calling.
mm,
And so I don't think it's a lot of the other fancy or complicated things that we think it is. It's more about what has he called you to and what has he not released you from? And that has been really important to us. I will say that through that base camp revelation, which to be honest with you was not someone everyone was clapping their hands about at the
yeah,
beginning. In fact, we had some pushback from some of our advisors about the base camp process, but we really felt that if we were not very intentional about inner healing, that it would be the kryptonite that collapsed what God had called us to. That this was
mm,
so critical that we invest in inner healing in the team. And now when I look back and see how that is what scaled compassion, that
mm,
is what allowed a reset or a a purification process or sanctification process that never would have happened without that revelation that he gave to us. So I do believe that calling can scale now. I do believe that calling can be replicated. I see this from a very different perspective than I saw, a decade plus ago.
mm. Yeah, and as you say, God tells us things on a need-to-know basis. His words are light to us, our path, but not our horizon. And I think if he showed us too far ahead, we might not take the next step. But
That's
it's
very right.
it's amazing the way that I think you really see the wounded healer coming out in this, people's own pains and difficulties and your own challenges early on as well, and the way that God used those to spur you on, and how a major focus became the inner healing of your own staff and volunteers, and the way that they then contributed to the program. It's just a wonderful testimony. Can I
Maybe
just a more
before you
practical?
ask the next
Yeah,
question, Peter,
yeah,
I just want to
yeah,
say that the most difficult season for me was that season we couldn't pay salaries. By
yes,
far, of
yeah,
everything that I've experienced, that was the most difficult season. And as we all know, typically when you cannot pay salaries in our context, there will be strikes and violence and other kinds of pushback. And the fact that all of the team members kept working, didn't go home.
yeah,
And I told them, that, listen, we understand if you want to go wait this out at home. And we were very open with them about, the payment systems have been stopped. We are due, funding. We don't know when it's going to come, those kind of things. And the fact that they all kept working, it was so painful for me to walk around the campus and look people in the eye who I knew their kids weren't eating, who I knew kids weren't going to school. But and the healing that we all need, I really believe God has used this to create a peace and a resilience that would have never been there otherwise. So I just wanted to end on that note. Sorry to.
No, that's fantastic. Striking in your presentation, of course, was the role of your family and the four boys all going away, getting very useful degrees for your context, and then coming back and wanting to work with you. And of course, what brought you both together right at the beginning was your individual calls to mission that then came a joint call. What have you learnt as a family journeying through this? And I'm thinking particularly of many others who'll be in the situation of working in mission with their families, the key to getting them all involved and contributing and really loving the project.
Well, all I could say is that my husband, who's always been the one who's taken care of the family,
Mhm.
he said after the triplets graduated from university, I guess the experiment worked.
Mhm.
Because the whole time you didn't know how this was going to unfold, but we knew God was calling us as a family. And we've asked the children, actually, some people that come and visit us in Eswatini, they ask them a lot of questions because a lot of people, which I didn't realize that this was going to be, kind of an important part of just the journey that God has had us on. But they say, why did you guys stay? Like, what made you stay? What I've heard my kids say over and over is that mom and dad took us with them when they were
Mm.
serving. They
Yeah,
didn't go serve and leave us behind. And
yeah.
of course, Peter, when we were doing that, we didn't know if we were doing the right things. I remember seasons, you can imagine 20% of the country's orphaned. There's this huge crisis around HIV. People are hungry, people are devastated, their parents are dying. You can imagine that at times there were certain kind of safety situations with the children. I remember sometimes when Harry and I'd be working late, sometimes the kids would get choked and things were happening out there that you can think like, what am I exposing my children to? But when I look
Yeah.
back now and I see how much of a role it played for them just to journey with Harry and I realize now that God was using that to plant a calling in their lives that was separate or unique from ours. And
Yeah.
we're grateful for that. And in these past 5 years, really, because of the huge demand on our institution, as you know, and we've talked about before, have been difficult years. And to
Mm.
see these grown children now come alongside us and us be able to turn to them for advice is just a gift that I never thought would happen. And we did realize at some point that they have bypassed us because they
Mm.
grew up there. So culturally, their formative years were there, and they
Mm.
understand the culture in a way and the context and the environment in a way that we don't. And
Mm.
so we are really grateful, and we just thank God for this gift that really was unexpected gift and blessing. But yeah, if you note, they all went and got business degrees, almost all of them, which I think is a precursor to
Yeah.
where we're headed in global health, is that we're going to have to really set firm foundations on business principles. So we're really grateful for their role and coming alongside us. Of course, it's a big team, and they're just one, member of that. But we are grateful for them being
Yeah.
there, and we're grateful that our staff want them there, and we tell them
Yeah.
that whatever you do, the team wants you. It doesn't have to be that way. So we're grateful for the team unity in that respect.
Yeah. Oh, praise God in that. Well, now we got a good picture of what you're doing from the videos, which are beautifully put together. I just wanted to ask you just to walk us through the HIV program. So, uh, patient comes in, gets diagnosed, and so on. Just walk us following them through the treatment pathway and management of complications and so on. What are you able to supply at what level?
Well, thank you for that. For the HIV part, of course, we all know that HIV was our prevailing issue, especially when we entered into Eswatini in 2004. As I mentioned, people were dying everywhere. There was nowhere that we went that were not young people dying and families devastated. But what we picked up immediately is that people felt highly stigmatized. Care. So when a patient comes, if it's a rash that they are worried about, if it's a cough, we start there. What's important to the patient? Okay, we start there. Once we develop the relationship, that's when we move to things that are more stigmatized, like HIV care. And
Yeah,
that God has used that approach to allow really huge, very open doors to, I would say maybe one of our roles has been reaching the last of the last, who is in that
yeah,
5% or that 7% that hasn't been reached yet. And really, Peter, it's through the platform of integrated or holistic care and,
mm,
whole person care. And so that is what I would say has been the most, we just have not had standalone HIV programs. It has never been from the beginning. And to be honest with you, at first we applied for a PEPFAR grant and were told that comprehensive healthcare is not an approved strategy for PEPFAR care and
yeah,
treatment or prevention. Initially in 2009, that was what the letter said to us. And so to see the way that that's progressed and really integrated and comprehensive care being the standard of care now, we are so excited about. But once a patient is identified as being HIV positive, they of course are taken through the normal protocols and workflows. But one of the things that has really helped us is the digital system. For instance, once a person, maybe let's say they test negative, it will actually prompt you when the person is due to test again. For cervical cancer, which is our next tsunami, it's our number one cause of death for women ages 15 to 49 in Eswatini. So really critical that we're doing early screening for cervical cancer. So the system, if the person comes in, let's say they come in to see the dentist, but it'll flag in the dental department to say, listen, this person is due for VIA or cervical cancer screening. So that link and making sure that we don't leave any gaps for progression of disease has been really critical. Of course, that's developed over time. But really focusing on the workflow and the process to make sure that once we've identified someone as positive, or even if we've risks and progression of disease in a way that doesn't leave loopholes or gaps for progression of disease. I hope that answers the question. It's
yeah.
really been through integrated, comprehensive approach.
What sort of difference have antiretrovirals made over the years that you've been working on the disease in Eswatini?
Oh, massive. I mean,
Mm,
people are living to 70 to 80 now. And just
mm,
like if you have diabetes or hypertension and it's well controlled and you take your medication or your treatment is well defined, it's made such a massive difference. So of course,
mm,
that uh, some of the disruptions of the last year are concern to us. Our new infection rates are going up. Thankfully, we've been able to maintain everyone on treatment that is in our facility, as well as maintaining viral load suppression. But we've had
mm.
to adjust or downscale some of our other programs to ensure that this particular area we don't lose ground. But I will be very frank with you. Some of our prevention programming is not as strong as it used to be just because of funding gaps.
Yeah. And of course, you started as an HIV clinic and service, but now we're seeing from the videos and what you've said, you've got cervical cancer screening and treatment. You've got people with COVID on ventilators. You've got visiting orthopedic surgeons and so on. So you've got a much more comprehensive health service. What other specialties have you got represented at the moment and through the Luke Commission in the hospital?
We specialists that we have that are full time with us, OBGYN, general surgery, orthopedics, ophthalmology, pediatrics, internal
Mm,
medicine,
mm.
critical care and anesthesia. Those are the specialists that we have that are full time at TLC.
So they're full time there, yeah.
Yes.
And I'm hesitant to ask you this question, but you must look back over 20 years and just be absolutely gobsmacked by what God has done in and through you and through the team. When you look forward, what do you dream of seeing? You're already talking about people coming from all around the world, seeing what you're doing and saying, hey, these models are scalable. We could use them elsewhere. Every country in Africa could benefit and so on. What's your dream and vision going forward over the next 10, 20 years, if the Lord tarries?
My dream is that, what I've realized, I think you remember that we used, private funding to start TLC,
Yeah.
and we're recognizing, or transitioning in a difficult season, really back to those roots. And while of course our faith foundation, and of course our spiritual care, and of course our commitment to primary care, and all of those kind of things are important, and I'm talking for all faith-based institutions, reality is the future is going to demand us to be commercially viable. And I hate, sometimes we don't even like using those words. We like to say compassion and love and all these, but the future is just I've spent actually quite a bit of time engaging globally at policy level, at congressional level, hearing what people are thinking. And there's just such a strong push to commercial viability moving forward that I I believe operational excellence and supply chain excellence is going to save more lives than anything else. That operational excellence and supply chain excellence and attention to business detail is going to allow us the next season of compassion, of spiritual care. And without that, I really think that our faith-based institutions are going to continue to survive instead of thrive. And, while we're going through this transition, even as an institution ourselves, I heard one of our staff, our lead staff, one of our business people say, for the first time in 20 years, the steering wheel of someone else's hands. And I feel that God is taking us kind of through a tip of the spear experience to figure out how do we decode or make scalable a commercially viable faith public private partnership that actually allows us to thrive and not survive. So that's what I'm excited about, Peter.
Yeah, and that's certainly something to be excited about. So just a final question, and we all know the incredible crisis that was provoked by the withdrawal of USAID funding all over Africa and all over the world, really. And it solutions for funding, and you had to go through that very difficult 3 months of not being able to pay staff. Looking back now at that crisis, and they say every crisis is a mixture of threat and opportunity, that the grey cloud of threat, the silver lining of opportunity as well, it's there to grasp. Just a year or so on, can you see what opportunities that USAID crisis has put before you in terms of going forward?
Yes, I sense such an openness to breaking down our silos, to working together more collaboratively, to speaking as with one voice, setting aside the 20% we don't agree on as faith-based institutions and focusing on the 80% we do, because I believe if we really looked into this and put it under a microscope, we would say we agree on 80%. There's probably 20% we don't. And if we agree 80%, that's enough for us to move forward collaboratively. And I really believe that unified voice is going to allow us to have an impact, not just in Africa, but even in other continents in a way that we can't in our own fragmented silos. So I am really excited about that, and believe that the next season is opening up and making us willing to engage in ways and to collaborate in ways that maybe weren't necessary in the past season. And I think that represents God's heart for his people.
Yes, and the unity, collaboration, and partnership. And you've talked about WEA, the World Evangelical Alliance, and the CHAs, and with the Eye of Faith, see a whole lot of streams flowing together, and it's a great opportunity for us to grasp. Echo, thank you so much. We could go on for ages. Now we have to stop, unfortunately, because the hour is up or even a bit past. But thank you so much for all you're doing, for the inspirational testimony, for all the care that you put into this presentation. So see you again soon. Thank you for joining us. May the Lord bless you.